Hi, my name is Lars Hallström. I'm a professor of political science at the University of Lethbridge, and I'm the director of the Prentice Institute for Global Population and Economy, and I'm the lead researcher behind the Health in the Watershed Atlas for the Battle River.
Congratulations, you and your research team have recently completed a very comprehensive study of the Battle River and Sounding Creek watershed, and out of that have created a Health in the Watershed Atlas. Taking notice to take action, integrating environment, community, and health is nearly 400 pages of maps, graphs, and information. Can you explain how a project of this scale and magnitude came to be, and what exactly it is, and who you envision using something like this?
Of course. So the Health in the Watershed Atlas was designed in collaboration with the Battle River Watershed Alliance, and is really designed to help move the state of watershed reporting forward, both for that watershed and for watersheds around the province and even across Canada. The idea being to move away from just hydrological, so water quality and quantity questions, and actually looking at bigger picture issues as well as those water quality and quantity kind of concerns. So this allows us to think about things like social impacts, ecological impacts, relationships with agriculture, relationships with oil and gas or exploration or extraction, and it gives us a much bigger and more comprehensive picture of how the human footprint and the interaction with the environment in the watershed actually takes place.
The Atlas includes many maps and has great aesthetic appeal. It's comprehensive but also has great ease of use. Were there many others involved in this project, and where did the funding come from?
So there was a large team working on this particular atlas. As you perhaps noted, there's 400 pages of images, tables, text, and of course the maps. I think we have over 110 maps in the atlas. So we had a team of about 15 people or so who worked on this over the course of a number of years, ranging from people doing the mapping itself and working with raw data from the province to people who were writing text and providing editorial services, doing annotations, and doing even just the bibliography itself, and the indexing for this is really large. So there's a really great team, and all of this work was funded through a combination of the Canadian Institutes for Health Research, which is the federal funding agency for health-based science and medical science in Canada, as well as funding from the Prentice Institute here at the University of Lethbridge, and also with some additional funds from other funders like the support of the Battle River itself.
The data researchers used for this project was all publicly available data. So is the Atlas something that you could anticipate could be created in other parts of Alberta or Canada or even globally?
Yes, that is in fact part of the intention of the way that we designed both the initial framework and the atlas itself, is that we do use data that are available and in the public domain. So in theory, any watershed or similar organization could replicate the atlas. It would take quite a bit of work. They would still have to work with the raw data and select it for their particular watershed, but it's something that we had always hoped could be done either to scale up at a fully provincial level or within the different watersheds here in the province or across Western Canada.
At the beginning of the Atlas, there is a Health in the Watershed Assessment Framework, which is a model that includes sectors, measures, and indicators. Can you see this type of assessment framework working as a model for other watersheds or jurisdictions in Canada?
Yes, that framework is derived in part from the Sustainable Development Goals set out by the United Nations, and it's something that we hope would be used, or had hoped to be used, to help watersheds, again, measure what's happening, this is part of the taking notice to take action, to understand from an observatory function what's taking place at the human, environmental, and health interface, and then ideally to inform public policy or decisions by watershed management groups or ecological or health-based groups to have more evidence-informed decision-making and to understand how things are changing over time.
If other watersheds or jurisdictions were considering creating a Health in the Watershed Atlas such as this, could they use the measures and indicator wheel model your team used, or is it region-specific?
They could absolutely work with what we've already done, and they can take that and then either drill down in more detail depending on the kind of data that they have available to them. Each data set is different. We have about 400 data sets sitting in the background for this kind of work, so sometimes you have to get into different scales in terms of doing the mapping and the analyses, but they could absolutely replicate this, or if they wanted to, they could contact us and we could replicate it for them potentially.
Working with the Battle River Watershed Association and using the Battle River and Sounding Creek watershed as a case study area, was there anything that came out of this study that you or the other researchers were not expecting?
I think we had a sense in the background that there were dynamics, particularly from an economic and from an energy sector standpoint, that were pretty pronounced on the landscape. And as we drilled into, pardon the pun, looking at just how intensive both agriculture in certain areas as well as oil and gas exploration and extraction have been. We're looking at about one drill well per every square kilometer in the entire watershed. It's about 47,000 wells and approximately 47,000 kilometers. So we knew it was intensive, but that kind of puts things into a different context because you don't see pump jacks or derricks or rigs necessarily scattered every single square kilometer, but there's a lot of activity from the energy sector in that part of the province.
As one of the leads on this project, is there anything you would consider if you were just starting this project now that you hadn't previously considered?
I would definitely undertake this project. We did do a lot of scoping to see if other people had done things similar to this. There aren't many initiatives. People have started these kinds of initiatives and typically not finished them because they're really, really big and quite expensive. So we were very lucky to have the funding support through the ECHO network from CIHR to actually do a project of this size. So I would definitely caution somebody or would think about trying to take this on my own without significant supports or help. To start from scratch would be a really, really difficult initiative. And this took almost 4 years to do from start to finish. So you need to be aware of what you're signing up to do before you do it.
Is there anything else that you would like to share about the case study that led to the creation of this incredible comprehensive Health in the Watershed Atlas?
Well, I think what we really want to see, and this was always the goal from the watershed itself, is to, and they've actually adopted this as their State of the Watershed report for 2022 and for the next 10 years. So what we really wanted to see was a way of understanding how watersheds and integrated watershed management can actually be thought about, measured, and understood, both from the standpoint of integration, from the standpoint of measurement, from the standpoint of tracking and taking notice, but then also starting to think about where are the spaces where we may need to apply interventions or change if we can.
And for those interested in this Health in the Watershed Atlas project and the resulting atlas, where would they be able to find more information about it?
So yeah, there's a digital version of the atlas that is housed online at the Prentice Institute website at prenticeinstitute.ca, and that's a PDF that's downloadable, it's fully indexed, it's lovely. We do also have some hard copies available if people are interested in those. We sell them at a very, very reasonable price, far below what they actually cost because we want people to have them. And they're also available actually at a number of libraries, both institutional libraries like at universities, but also we send them to the different school divisions around the province as well. So they hopefully are in the public school system as well.
Great, thank you so much.